Radiology Orientation.
Okay, this is our daily schedule, which you can find out here by our desks. This just tells what the date is for the day. And then here is our modality. So you have CT, ultrasound, MRI, if we have any pre or post-ops, fluoro, and then nuke med. And then this is the time slots for the day that go across the top. And that will tell you generally around what time the procedure will be coming. It's not always 100% that accurate, just also depends on anesthesia, so we'll try to move it around if it does get switched. So basically the thing that you guys need to pay attention to is ultrasound. If you're the ultrasound student, you need to see, does your patient need x-rays? If they do, it'll have plus rads written here, which we do prior to ultrasound, and then once you get those completed, you can cross them out. And then the only other thing you guys need to pay attention to really is the surgery, because we can show you guys how to do like pre and post stops. So this one is just a post op because it has a line through it. If it was written without the line, it would need pre-op rads as well.
Over here is the student schedule. So this shows your lunch times and also shows when you are on ultrasound and when you are the lead student. So the lunch times rotate like this. So these two will be at 1 o'clock, these two will be at 12 o'clock, these two at 11. Your lunch is an hour long. If you do leave for your lunch a little bit late, you still have to come back at your scheduled time. You can't just take the hour. So that'll rotate like this. So Chris is the 1 o'clock today, the next day she'll be the 12 o'clock. Then we have the ultrasound and the lead student over here. So the ultrasound student is pretty much in charge of making sure the patient arrives on time. The service that the ultrasound is coming from is in charge of bringing the patient down. But if you notice that the patient isn't here on time, you can let one of the techs know so we can contact the service. And then the lead student is kind of in charge of coming up front, seeing if we have any requests, taking the images, and positioning for the images. So this is where you're going to see that we have requests for radiographs. So these first three slots are unsedated radiographs, and you're going to want to grab those in order. So whichever is in the front, you're going to grab first, and you're going to work your way back. And then this slot are patients that need sedated, and that means that the service that the patient belongs to is going to bring it down sedated. So we won't grab these patients. We also don't grab these patients from anesthesia, so these patients are anesthetized, and anesthesia will bring those down for us. We've also got CT, MRI, and surgery. You guys don't need to worry about these top two slots, but we sometimes will ask you guys to grab a pre or a post-op from the surgery slot. To check if we have patients, it's always a good idea to come up here and check these slots, but you can also check online on CBIS. We have the radiology task list that will show up on there. Anything that is green means that it is approved and is ready for radiographs.
You will first hit the start button, and then you will go over to the equipment, and you will turn the equipment on, and then you will turn on the computer. And lastly, you will need to go back over to the equipment and you will need to hit manual so you can change your techniques.
So when typing in a patient, the first thing you want to do is make sure manual is selected up here, and then you're going to type in the patient's name. So you want to make sure it's in all caps. So the first thing you're going to do is type the owner's last name, then you're going to do dash first name of the owner, then you're going to do a comma, and then make sure there's no space after the comma, and then you're going to do the pet's name. After that, you're going to go to birthday. So you're going to type that in, make sure the year is the full year. If you have an age pop-up, that means that you typed it in correctly. Then you're going to put in the patient ID, which is the medical record number. And then you're going to put in if it's male or female, or if you don't know, you can put other. And then after all of that is typed in, you're going to press set over here. And this is the screen where you're going to select whatever you are doing. So we have protocols set up that you can select like a 3-view thorax, an NG tube check instead of selecting each individual view. So we've got thorax, abdomen, all extremities over here. So we'll say that we're going to do a 3-view thorax on this one. So we're going to select 3-view thorax. That's going to pop up over here. If you wanted to add more, you can go over here. We're going to actually do a 3-view abdomen, and we'll say that this is a small dog. If you're doing a big dog, you can select this. That pops up over here. After you have your whole protocol set up, you're going to do start exam in the corner. That's going to bring up this screen. So what you have to have on this screen is the accession number and the study description. So for the accession number, you're going to put the species. So for a cat, you'll put FEL. For a dog, you'll put CAN for canine. And then you're going to put today's date. And for this, you only need to put the last 2 digits of the year. So we'll just put 20. And then you're going to put the time in military time. So it's 9 o'clock. And then you're going to put the room letter. So we have room H and J. Those are labeled on the outside of the room. So we're going to say this is room H. Then study description, we're doing abdomen and thorax. So I'm going to type both of those. And then you can click OK. And then you want to make sure this turns green and says ready. If it says waiting and then you try to take an image, nothing will pop up. So we'll wait for that. So we're ready, and you can select whatever view you want to do. If we're going to start with D view, we can select that. If you want to start with a right lateral, you can select that. If you have any questions about how to do an accession number or what the abbreviation is for a species, you can look up here. This shows you how to put in the accession number, and then this down here shows you the abbreviations for all of the animals.
Okay, so most of your pictures, especially thoraxes, are gonna come up not very diagnostic quality. And so you have to use your ROI button right here. And then what you do is you just want to draw a box. Usually if you draw it in the abdomen, it makes it more of diagnostic quality. And if you say you do it in an area and it still doesn't look the way you want it to, just go to a different place and draw a different box until it looks how you want it to look. And then just say okay.
Here you can see in the left lateral thorax that is really white and is hard to make out the lung markings. You will need to use the ROI to edit this radiograph to make it diagnostic, like the right lateral thorax shown next to it.
The first thing you want to do when you come into the room is check your tube height, and it should be on the 40
there. If it is not, you can use this vertical button here and move that up and down. Second thing you want to check is make sure your table height is all the way up by clicking on your up button. It is. If it happens to be down a little bit, you can bring your table down like that. To raise them if they're a really large dog and bring them all the way back up. Sometimes you'll have to click it once or twice because sometimes it stops on its way up. There's also buttons here that help move your table. To help slide it, the only thing you have to watch is when you have a patient on the table, sometimes they jump with this really loud click. So make sure you always have a hand on them. There's 2 pedals on each side that you can use. You also have a 14 by 17 plate in here that moves with your tube, so you can hit this horizontal one here and see how that moves with your bucky, so you don't have to worry about having that lined up because it stays lined up. Up here we have our collimators, and make sure that always stays at the 14 by 17. You can open them up bigger, as you can see here, but your plate is still only the 14 by 17, so if your dog's really deep chested or thick, you might have to do 2 because you're not going to get it no matter what because your plate is still only this big. Next thing you want to do is you want to set your technique here so you can see your KVP and your math. You can change that by going up or down for both of those. We have a technique chart that you kind of start off with, for the most part, posted up here. And you might just need to change that based on your patient's size. The holders in the room will be holding the patients. We'll be getting a gown from the strap. You're going to put it on. There's a little strap usually on top. And then different ones are different, but then you can strap them around the back. You just kind of have to look and see. Make sure you pick a correct size so it's not drooping down on you. You should have it somewhat up on your neck. That way for when you pick up the Thyroid Shield, which is optional, but we recommend it because your thyroid is sensitive to radiation. You're going to put that up around here, and you should have that covered here so there's no gaps. The next thing you want is some gloves. You'll usually put exam gloves on underneath these to keep them clean, but this is what you will be wearing for being a holder. Make sure when you have your gown on that your radiation badge is underneath your lead and protected. That is just showing that the gown is doing its job and protecting you from the radiation.